Is it possible to pass chemo drugs to a partner through sexual activity?
That's an interesting question, and it's one that comes up quite a lot. We don't pass on any drugs that are unchanged through bodily secretions, but we do have some evidence that in the urine or in the feces and sometimes in the saliva of an individual, there may be breakdown products from chemotherapy drugs. So theoretically, that would mean that there's a possibility that there might be breakdown products also in either the semen or in the vaginal secretions of somebody. But we don't have any research on this to tell us how much that's the case, and we certainly don't have any reports that I'm aware of there being any adverse effects on the partners of anybody who's had chemotherapy and has been sexually active in the hours and days following the administration of chemotherapy. I think when you're thinking about safe sex during chemotherapy, really I suppose there are three things to consider. One is the potential for breakdown products to be in secretions that can be passed on through intimate sexual contact. But actually, as important, if not more importantly, there's the issue of safe sex generally, where you've got somebody whose immune response might be lowered because of the treatment that they're having, and their ability therefore to fight an infection such as a viral infection like herpes or a bacterial infection that's passed on through sexual contact would be lowered by them being on medication that affects their bone marrow. So for that reason, we'd like people who are maybe not in a committed relationship, maybe having more than one sexual partner, for them to use barrier contraceptives, because that enables them, if you like, to be sexually active but without there being a risk to them or indeed a theoretical risk to their partner. I think the third and last point is also in terms of not wishing to create an unplanned pregnancy during chemotherapy and indeed for up to 6 months following chemotherapy. Because the way chemotherapy drugs work is that they have an adverse effect on the DNA in the cell structure. So again, there's a possibility that if you create a pregnancy and you're creating a life that's built out of cells, that the effects of the chemotherapy drug on the cells could also have an adverse effect on a growing embryo. So for that reason, we advise people to use barrier contraceptives, again, to prevent a pregnancy during that time.
You mentioned lowered immune response. Could you go into a bit more detail about that?
Yeah, I think if people have got a low white cell count, particularly a low neutrophil count, their ability of their body to fight an infection that they're exposed to generally is lowered. That's why we advise people, not to be around individuals who've got chicken pox or not to be around individuals who've got very bad flu or something like that. Likewise, when you're in close sexual contact with somebody, you're in a position where you may not necessarily know whether or not that person has, for example, a virus or a bacteria that is harmless under normal circumstances, but because one has a lowered immune system, may actually cause problems to someone who can't fight infection. And that could be something as simple as contracting a thrush infection, for example, a candida infection. We've all got candida in our bodies. They're not problematic to us until we have a lowered immune response. So it's really avoiding the sorts of infections that under normal circumstances we would be able to fight or would be relatively quick and easy to treat. If someone does end up with an infection, then I think the key thing is for them to take that information to their treatment team so that we can screen them for that infection rapidly if they've got symptoms, and we can then get treatment in there early so that the infection doesn't get more severe. That would be the main reason.